This video is about the introduction of burn. To begin, let's take a simple example to understand the burns and the most common cause of death in burns. For example, the three people A, B and C caught burn. The rescue team arrive but the patient A die on spot. The most common cause of death on spot in burn is asphyxia. The patient B is taken to the hospital and die within the 3 days of hospital admission. This death is called as early death, and the most common cause of early death is hypovolemic shock. The patient C is taken to the hospital but he died in hospital after 3 days. It is called as late death, and the most common cause of late death is septic shock. So in short, on spot death is due to asphyxia, early death is due to the hypovolemic shock, and the late death is due to septic shock. But overall, the most common cause of death in burn is septic shock, because the burn destroys the superficial layer and the patient is prone to infection, which can lead to septic shock. A question arises that what is burns? The burns is defined as tissue injury produced due to the application of thermal energy in any form to the external or the internal body surfaces. By the tissue injury we mean the coagulative necrosis, and by the thermal energy we mean that any form of thermal energy. The most common source of thermal energy include flame, contact with hot source, scalds, electricity, chemical friction and radiation. So whenever these source of thermal energy came in contact with internal or the external body surface, and that thermal energy produce a coagulative necrosis, it is called as burns. Now let's discuss the zone of burns. By the zone of burns we mean the local effect of burn, that how our body will respond to the application of thermal energy. There are three zones of burns. The first one is zone of coagulation, the second one is the zone of stasis, and the third one is the zone of hyperemia. The zone of coagulation is the area where the thermal energy is applied. It is the most commonly affected area and the most severely affected area, and the changes which occur in this zone is irreversible, mean that there will be a coagulative necrosis which will not revert, and the depth of coagulation will correspond to the temperature and the duration of exposure. Surrounded by the zone of coagulation is a second zone called as the zone of stasis. The zone of stasis can revert or it will can undergo an irreversible changes. It will depend on the severity of the burns. Third zone is a zone of hyperemia. In the zone of hyperemia, there will be a vasodilation, so there will be the maximum supply to the zone of coagulation and zone of stasis, and it is a normal surface, and there are no changes. Then there will be no permanent changes in zone of hyperemia. Other than the zone of burns mean the local effect of burn, there are certain regional changes and the systemic changes in burn. So what are the regional changes in burn? The most common region which are affected in burns include circulatory system and the respiratory system. The regional circulatory system is affected whenever there is direct electrical injury to the limb. Mean when there is a high tension electrical burn, it will directly compromise the circulation to the limb. Other than this, whenever there is a scar formation, scar means the circumferential burns, it will compromise the blood supply to the particular limb. Apart from circulation, the respiratory system is also affected in burns. The respiratory system are affected in two ways, mean the area above the larynx and the area below the larynx. The area above the larynx is affected in hot gases inhalation. It will block the airway if the edema develop, and whenever a patient inhale a hot steam, it will affect the respiratory system below the larynx. It will destroy the epithelium and can cause a respiratory failure. Apart from the regional effect of burns, the burns also have a systemic side effect, mean that it will compromise circulation, mean that there will be a high amount of water loss from a body, so the patient should need a active resuscitation with fluid. Other than circulation, it can affect the gastrointestinal system, causing the curling ulcer. Apart from that, there will be a high calorie intake in burn, and the patient will have a loss of weight of about 0.5 kg. Other than these, the patient can also underwent the renal problems such as acute renal failure due to the hypovolemia or the myoglobinuria, and sepsis due to the destruction of the epidermal layer. So patient is more prone to infection. It was all about the introduction of burns. In this video, we study the introduction, the definition of burns, and the local, regional, and the systemic effect of burns.